Today I'm going to talk about why you might use coffee enemas, so stay tuned. Hey there, if you're new here, my name's Amanda Malacheski. I'm a certified functional nutrition health coach and a digestive and allergy detective. For tips and tricks on how to resolve your digestive challenges for good, please consider subscribing and be sure to hit the bell to be notified when I post a new video every week. So you may have heard of coffee enemas, and they're certainly popular in some circles, but you might not know when to use them. So by the end of today's video, you'll know which health challenges coffee enemas are beneficial for and when not to use them, and how they compare to other types of enemas. Coffee enemas are just one of the many tools I help my clients use properly to get gut symptom relief, and you can too, so let's get started. Okay, so coffee enemas are a detox tool that have gained a lot of popularity in the last maybe 10 to 20 years, especially in the context of things like the Gerson therapy, which is an intensive anti-cancer regimen that happens in residential centers. But I find that people are often a little bit confused exactly what their purpose is and how to use them. So I wanted to make a video to talk about that today. So a coffee enema uses brewed coffee, cooled down of course, diluted with some water as the enema liquid. So the primary purpose of a coffee enema is to encourage good detoxification process. The caffeine in the coffee inserted into the rectum helps stimulate bile flow from the gallbladder and also stimulates peristalsis in the gut, which helps eliminate toxins. And it also causes a 7-fold increase in an enzyme called glutathione S transferase. And this enzyme travels throughout the blood and binds up free radicals. And if you don't know what free radicals are, they're kind of charged ions that can run around the body and damage your cells. Things like smoking or eating a lot of sugar can cause free radical damage. So the gallbladder releases extra bile, peristalsis is stimulated, and your body grabs up and binds up toxins and free radicals that can do cellular damage, and therefore helps your body release them more efficiently. So for some reason, drinking caffeinated coffee doesn't have the same effect as a coffee enema. It does maybe help your bowels move, but it doesn't have these other functions of increasing the bile flow or increasing the production of this enzyme that can help detoxify your blood. So what should you use coffee enemas for? There's a couple of different situations where they might be useful. The most obvious one is if you're already doing some kind of detox or cleanse, like a spring liver cleanse or a juice cleanse. They can just help support the detoxification processes during that cleanse and enhance your detox. One of the other main ways that they're used is, like I mentioned earlier, in the Gerson therapy, which is an intensive anti-cancer protocol involving lots and lots of juice and liquids alongside the coffee enemas and other supplementation. This is usually done in a residential facility or with trained people to help people do this process. So you could also use them during antibacterial or anti-parasite treatment to encourage good bile flow and motility to help encourage the clearing of those infections. That's the main purpose of them in this situation. So something I do want to clear up is that coffee enemas are distinct from a regular enema that you might use to help clear constipation or for bloating or clearing out food sensitivities from your gut. And one of the main reasons for this is that coffee enemas are generally done with a little bit less water volume than a clean out type of enema. So for this reason, they just don't work as well for that. And if you need a little bit more information about how to do that type of enema for helping clear constipation or food sensitivities, you can go check out my video called How to Do an Enema at Home. I'll leave a link for that below this video. So there are some contraindications for using coffee enemas, and they're kind of similar to the contraindications for regular enemas, which I talked about in my last video. So they're pretty obvious, but here they are. So first of all, if you're somebody undergoing active chemotherapy, you should not be using coffee enemas. Also, if you have any kind of heart failure, kidney failure, or respiratory failure, you should not be using enemas because they can affect your electrolyte balance and really impact those body systems. If you have any kind of bleeding or ulceration in your stomach, or if you have any digestive disorders like ulcerative colitis or Crohn's disease, basically inflammatory bowel disease, you should avoid using coffee enemas and other types of enemas. High blood pressure is another situation where you would want to avoid using enemas for the same reason as the kidney, heart, and breathing issue. Also, you wouldn't want to use enemas if you have diarrhea for an unknown cause happening. So until that's been investigated and you're clear that it's not anything really serious, you shouldn't be using enemas. And of course, I think this goes without saying, but if you're pregnant or you've recently had some kind of bowel surgery, you certainly should not be using enemas. Now, how often should you do coffee enemas? So the Gerson Institute, which is kind of the expert opinion on this matter, says that unless you're doing their full protocol with all of the measures that they take to keep the electrolytes balanced, they suggest you shouldn't really be doing them every single day. They recommend that people who are not following the Gerson protocol and are using coffee enemas should be really attentive and careful about making sure that they are getting rehydrated after using coffee enemas. And I think that this leans towards a suggestion of using coffee enemas sort of infrequently. I think similar to my recommendation about regular enemas, it might be 1 to 2 days a week maximum. And if you want to be using coffee enemas more frequently than that, I would strongly suggest or recommend that you connect with a practitioner that can help guide you on that process and keep an eye on you and make sure that you're not harming yourself. Okay, and I imagine that some of you are maybe going to ask me about, well, how do coffee enemas interface with regular enemas, and can you or should you use them together? And I think one way to do it might be to do a coffee enema first thing in the morning, and then to follow that up immediately with a clean water enema, just to make sure that your whole intestine flushes out. Again, you would want to be really careful about getting dehydrated and shifting your electrolyte balance, so do be attentive to that if you use this process. And if you have any questions about that, please connect with a practitioner who can help you customize this protocol for yourself in a way that fits your unique situation. Have you used coffee enemas before, and did it help you? Tell us all about it in the comments so other people can benefit from your experience. Okay, so coffee enemas help encourage bile flow and normal detoxification processes. They are useful during cleanses or antibacterial or anti-parasite cleanses, and generally 1 to 2 days a week should be sufficient to support this process in your body. And if you're needing help with some other gut challenges, there's 2 main ways that I can help you. The first is I really encourage you to download my gut guide called Roadmap to Gut Recovery. It includes the step-by-step process that I walk my clients through to help them resolve their digestive challenges. And it also provides you access to some of the tools that I use to help my clients get clear on some of these questions for themselves. You can download that by visiting confluencenutrition.com/roadmap, and I'll be sure to leave a link for that below this video. Or if you've already tried quite a few things and you're left feeling really confused about where should I go next, I encourage you to schedule yourself a free 30-minute assessment session with me. We'll chat about where your situation is and what might be the next best steps for you, and you'll have a chance to talk to me about what it might be like to work with me. You can schedule that by visiting confluencenutrition.com/contact. Okay, I hope this video helped you learn about what the benefits of coffee enemas are, when you should use them, and how often would be appropriate to use them. If you like this video, please consider liking, sharing, or subscribing it, and pass it on to somebody who could use it. I will look forward to seeing you next week. See you then.